Vaseline is one of the most popular skincare products in the world. For decades, people have used it to treat dry skin, chapped lips, minor cuts, and a variety of other skin concerns. It's often viewed as completely harmless because it's been around for so long and is recommended by many healthcare professionals. However, while Vaseline is generally considered safe, there are some potential health risks that deserve attention. One of the most serious concerns involves a condition known as lipoid pneumonia. This is a rare but documented medical condition that can occur when petroleum jelly is repeatedly applied inside or around the nose and tiny amounts are accidentally inhaled into the lungs over time. Because petroleum jelly is oily, the lungs have difficulty removing it. As it accumulates, it can trigger inflammation and interfere with normal lung function. People affected by lipoid pneumonia may experience chronic coughing, chest discomfort, shortness of breath, or persistent respiratory symptoms that are difficult to explain. In several documented cases, patients underwent extensive medical testing before doctors discovered that long-term petroleum jelly use near the nose was the underlying cause. While the risk is low, it highlights the importance of avoiding regular application inside the nostrils. Another concern is skin irritation and allergic reactions. Many people assume that because Vaseline contains very few ingredients, it cannot cause skin problems. However, human studies and dermatology reports show that allergic contact dermatitis can occur in some individuals. Symptoms may include redness, itching, burning sensations, swelling, or the development of a rash. These reactions are uncommon, but they do happen. People with highly sensitive skin or existing skin conditions may be more vulnerable. In some cases, what appears to be worsening eczema or irritation may actually be a reaction to a product that was intended to help. Vaseline's ability to form a strong barrier on the skin is often considered one of its biggest advantages. However, that same property can sometimes create problems. Petroleum jelly traps moisture, but it can also trap sweat, bacteria, dead skin cells, and excess oil. This may contribute to a condition called folliculitis, which is inflammation of the hair follicles. Folliculitis can cause red bumps, tenderness, itching, and acne-like breakouts. Areas of the body that naturally produce more oil or experience friction may be particularly susceptible. While petroleum jelly does not directly infect the follicles, the environment it creates can make irritation and inflammation more likely in certain individuals. Many people also use Vaseline on the face without realizing that it may not be ideal for every skin type. Although petroleum jelly itself is not considered highly comedogenic, meaning it does not readily clog pores on its own, its occlusive nature can sometimes worsen existing acne. If dirt, makeup residue, excess oil, or bacteria are present on the skin before application, Vaseline can effectively seal those substances against the skin's surface. For people with acne-prone skin, this may contribute to worsening breakouts over time. This doesn't mean everyone who uses Vaseline on their face will develop acne, but it does mean that skin type and proper cleansing matter. Another important issue is the potential for infection when Vaseline is applied to unclean skin. Petroleum jelly is not an antibacterial or antiseptic product. It does not kill germs. Instead, it acts as a seal. If the skin is not properly cleaned before application, bacteria and contaminants may become trapped beneath the protective layer. Healthcare professionals often recommend cleaning wounds thoroughly before applying petroleum jelly for this reason. The product itself is not causing the infection, but improper use may create conditions that allow bacteria to thrive. There are also concerns related to the use of petroleum jelly in intimate areas of the body. Some healthcare experts advise against using petroleum jelly as a sexual lubricant because it can be difficult to wash away and may increase the likelihood of certain infections. Research has found associations between petroleum jelly use in the vaginal area and increased rates of bacterial infections in some women. In addition, petroleum jelly can weaken latex condoms, increasing the risk of condom failure. These are important considerations that many consumers are unaware of. Another risk that receives very little attention is the fire hazard associated with petroleum-based products. Petroleum jelly can soak into fabrics such as clothing, bedding, bandages, and dressings. Over time, these materials may become more flammable. Safety investigations have documented serious burn injuries and even deaths linked to fabrics contaminated with petroleum-based products that were exposed to cigarettes, candles, heaters, or open flames. The product itself is not highly flammable when sitting in a container, but once absorbed into fabric, the fire risk increases significantly. This is why safety agencies continue to issue warnings about the proper handling of petroleum-treated materials. There is also the question of contamination. Modern petroleum jelly products undergo extensive purification processes and are generally regarded as safe. However, experts emphasize the importance of purchasing products from reputable manufacturers. Historically, concerns have been raised about impurities that can be found in poorly refined petroleum products. While high-quality petroleum jelly sold by trusted brands is highly purified, consumers should still be cautious about using unverified or counterfeit products from unknown sources. Some people believe that because petroleum jelly forms a barrier, it helps the skin breathe. In reality, it creates a nearly water-resistant seal. While this can be beneficial for locking in moisture, excessive use may sometimes contribute to overheating, excessive sweating, or discomfort, particularly in hot and humid environments. Individuals with certain skin conditions may find that heavy occlusive products make symptoms worse rather than better. It's important to keep these risks in perspective. Human research and medical evidence generally show that Vaseline is safe for most people when used appropriately. Serious complications are relatively rare. However, the fact that a product is commonly used does not mean it is completely without risk. Problems can occur when petroleum jelly is used incorrectly, applied in sensitive areas, used on unclean skin, or used by individuals who are particularly susceptible to irritation or infection. The bottom line is simple. Vaseline can be an effective moisturizer and skin protectant, but it should be used carefully and with an understanding of its limitations. Avoid putting it inside the nose. Make sure the skin is clean before application. Be cautious if you have acne-prone skin. Avoid using it as a lubricant with latex condoms. And keep petroleum-soaked fabrics away from heat and open flames. By understanding both the benefits and the potential risks, you can make informed decisions about whether Vaseline is the right product for your needs and how to use it safely.